Livingstone Musinguzi is one of those who lost their sight due to glaucoma, a condition that causes damage to the optic nerve, a leading cause of irreversible blindness globally. At first, Musinguzi did not take the condition seriously, but over time he began to experience gradual vision loss, culminating into the complete loss of sight in his right eye.
The issue with my right eye started small. Then eventually, it became worse until I completely lost it.
It can be a result of raised intraocular pressure in the eyes. We are commonly aware of pressure in the blood, but we also have pressure in the eyes. And this, once it goes high, it tends to affect the nerve, which transmits messages to the brain, and we see what we see.
According to eye experts, vision loss due to glaucoma is usually not noticeable to the patient in the early stages. This is because vision loss starts in the side vision and later progresses towards the central vision field.
It is irreversible. No matter what you do, you cannot restore what has already been lost. So most people tend not to be getting the treatment in time. And the subtle thing about glaucoma is that it damages everything without you noticing. It doesn't necessarily cause pain. So the vision just goes without your knowledge. And by the time you discover that actually I don't see very well, most of it is lost.
Experts acknowledge the growing demand for specialists in glaucoma, as well as a shortage of other eye specialists in public health facilities. However, they are also emphasizing the crucial need for accessible equipment in the treatment of this condition.
So because, for instance, if we have, let's say, about 40 ophthalmologists, and then each one of them is taking care of 1 million eyes, ideally, then the workload on the eye care team is too much.
In the whole country, I think we have less than 2 people who are interested in glaucoma surgery. So we need to get more people. At least each field, each region in the country should have somebody. And then we need, of course, the equipment that are used to treat glaucoma. We need laser surgery, which is easier and more convenient.
Some of the risk factors of glaucoma are high eye pressure, diabetes and hypertension, especially among those who are 40 years and above, among others. Occasionally, those with previous eye injury can become candidates.
And one of the other things that comes in as a sign and symptom is sometimes when you look at light, say it is a torch, or it is bright light at night, or it is a bulb at night, one can tend to see round rings like of a rainbow around it. Or if someone is driving a car and they shine full lights at you, you see a round ring of rainbow around it. That's called a halo. And so that can be one of the effects to show you.
Eye specialists want the public to consider regular screening to prevent blindness. Nobat Atkunda, NTV News.